Well, joining us from Penarth in Wales now is Richard. He doesn't want us to use his surname, but he now suffers from chronic pain after having a hernia mesh implant fitted more than 6 years ago. Hello to you, Richard. Tell us what impact this has had on your life.
Well, I've got 4 mesh in me now, 2 different types, and ever since the first operation I've had continuous pain. It varies, the place of the pain varies slightly from day to day, but what I do know is if I try to walk anywhere very far, the pain gets a lot worse and I have to stop. Even if I'm standing for more than a few minutes, I get a sudden sharp pain in the left groin, which means I've got to sit or lie down very quickly or I'll collapse. And that's a pretty intrusive situation. It means I can't do much in the way of work. I still need to work because I don't have much of a pension, but I can't. There's very little I can usefully do at the moment.
So what have doctors said when you've told them about the level of pain that you're in?
Well, this is the worrying factor. They don't seem to understand it, and yet from the information we have, I'm sure they do understand it. Yes, they've been putting me on painkillers like Dermot, and those painkillers themselves have side effects. They affect the memory, they affect other functions within the body that I'd prefer not to discuss, but they're still very nasty side effects. I want to get off those painkillers, and until they can do something about the pain caused by the mesh, I can't.
Yeah, I mean, were you warned about the potential risks at the time you had your first surgery, and were you given alternative options?
I've been given no alternative options at all. I was not told they were going to use any form of plastic or polypropylene device inside me. That's on 4 separate surgery occasions. I was not told until the last one, when they mentioned a mesh after I'd had my pre-med, so I wasn't really with it. And at that stage, I had assumed it was some sort of fabric mesh, rather like the sort of thing they use for dissolvable stitches. But obviously that was a wrong assumption. It was a plastic polypropylene mesh. I mean, polypropylene has been known to react with body fluids ever since the Chevron Phillips chemical company did their report back in 2005. So the medical profession should be aware of this. It's just that they're not reacting to it because it is so much cheaper and easier to put patients at risk.
And we heard from an expert in Charlotte Lomas's report that actually it is easier, it is a quicker operation, and it is still the most effective treatment for hernias. What would you like to see happen, though, now?
Well, I challenge the fact that it's more effective if people are becoming disabled. Different people have different degrees of disability. I have quite a severe disability, but other people I've met have said, yes, we've had constant pain since we had the surgery. It's not enough to stop them working, it's not enough to interfere with their life, but I believe that any long-term pain like that doesn't come as part of a successful procedure. It's a failure. What I'd like to see happen, obviously, is that the use of mesh for elective procedures, in other words, those you choose to have rather than an emergency, is suspended until the professionals have found out what it is in the polypropylene that is reacting with bodily fluids, because that's what Chevron Phillips found on their tests, that the polypropylene would react with the bodily fluids and produce unpredictable results. This needs to be suspended. There are alternatives for all the elective procedures. Now, in the case of hernia repairs, there's a method known as Shouldice, which was developed at the Shouldice Hospital in Canada, and it's been extremely successful and doesn't have any of the side effects that we're experiencing now. But unfortunately, the medical profession has set its mind against this. You see, what they do, they tell the patients that it's not the mesh once they find out there is a mesh. But I wasn't even told there was a mesh after I complained of the pain, even though I told the surgeon that felt like I had a knife sticking into me where he'd operated. Those are my words to him. And I was, I suppose, jokingly saying, "You didn't leave anything in there, did you?" Well, that was meant to be humorous, but the fact is they did leave something in there, something which is now very sharp and pressing on parts of my body. But he didn't admit it until I challenged him specifically.
Richard, thanks very much for talking to us, and we wish you all the best.
Thank you.
It was Sky News. Coming up.